Are you taking a pill like this one? Or do you maybe take a pill that's kind of like this, like a gel cap? Or what about some of you who might take the little round ones, right? What about those? And anybody taking a small pink one? One more. How about those of you who might be taking what we call horse pills, those really, really, really big ones? Now, no matter what pills you take a day, let me tell you, there's a right and a wrong way to take your pills. I'm going to tell you the right way and also going to tell you what could happen if you take them the wrong way. By the way, I'm Dr. Jen Caudle. I'm a practicing family physician. I'm an on-air health expert and video creator. First of all, why we're talking about this is because if you don't take your pills the right way, they can actually get stuck in the esophagus. That is right. First tip is to take your pills with water. I know you guys are like, well, duh, but I want you to take it with 8 ounces of water. And you know why? Because if you don't, that pill could literally get stuck in the tube or the pipe going down in your esophagus. And by the way, not only could that cause either chest pains or heartburn feelings, but if it still remains to be stuck, it can actually cause damage to your esophagus or to that region, by the way. That, guys, is super important. Your first rule of thumb is at least 8 ounces of water, any water, not just this water. It doesn't matter, okay? That's the first thing, all right? Second thing is, many pills have a certain time of day when you must take them, okay? That's just the case. But if your pills are not supposed to be taken at a certain time of day, and even actually if they're supposed to be taken in the evening, I need you to avoid taking your pills right before bedtime. That's right. I need you to have at least 15-20 minutes between your pills and when you lay down to go to sleep. You know why? Because you take the medication, then you lay flat. These bad boys could really just get caught in your throat. We don't need that, okay? The other thing is, I want you to take these pills when you are upright, when you are standing up, or when you are sitting up. Don't take your pills when you're lying down. Also, will make it harder for these little guys to go down your throat and get where they need to get to work and actually do what they're supposed to do, guys. But let's say the water is not doing the trick, okay? And I have many patients where they're like, Dr. Jen, I just can't take these pills. It's just not working. All right, fine. Water doesn't work. Okay. Well, you have other options. One option is to get your favorite applesauce or pudding and just drop the pills in there. As long as you can take them with food, by the way, but that can be an option. And eating them with applesauce or pudding could really make the medicine go down a lot easier, okay? The other thing you can do for many medications, of course, gel caps, you can't do that with, but some others you can actually crush, okay? You can put them, the crushed medication, on the applesauce or the pudding. You got to check with your pharmacist and your doctor about whether or not you are allowed to crush your medications before you do that, okay? Don't go crushing stuff if you don't know explicitly that you can, okay? That's very, very important. And keep in mind, this is really important, especially with like long-acting medications or certain formulations of medications. Enteric-coated things, not gonna be crushing that. All right, now the other thing you can do is you could get a pill cutter. Not a pill color, a pill cutter. That's great for big horse pills like this one. Sometimes they are scored. If you look at this pill, can you see that? Let me try to see. Yeah, there we go. I think you guys can see. When I say scored, I mean that there's like a little line, okay? I'm going to try to bring it closer. A little line in the middle, and that's like a natural indent where it can be cut. So if you have a pill cutter, you can actually cut the pill in half. Of course, you got to make sure that the pill is able or allowed to be cut in half. Guys, so I hope these things are helpful. Remember, if you don't swallow your pills the right way, they could get stuck and actually cause damage to this area. We don't want that. Upright or standing up, make sure that you don't take your pills right before bedtime. The water is your friend. And the other thing I should say too is if pills are just not working for you, no matter which way you slice it, no pun intended, you can always ask your doctor or your pharmacist for another formulation. Sometimes medications come in liquid form, they might come in powder form, they might come in cream form, it just depends. So talk to us doctors and your pharmacists if you need a different option. So anyway, happy pill taking, guys. Of course, prescription pill medication taking, of course, and according to doctor's advice, y'all. That's what I'm talking about. Guys, please pass this information on to your family and friends. It's super important. Let me know in the comments if you think this was helpful and what suggestions you have for taking your pills. You might just help someone else. Guys, I'm Dr. Jen Caudle. Also, if you've not liked and followed my page, I invite you to do so. For those of you who send stars, I respond to you personally. Guys, I'll see you soon.